We now begin this new half hour with today's health headlines, talking about how to catch up on sleep after the clock springs ahead and the health risks that come with losing an hour of sleep.
All right, joining us now this morning to talk about it, Dr. Christine Wine, Director of Women's Sleep Medicine at Yale Medicine and Professor at Yale School of Medicine. Doctor, thank you so much for being with us this Monday morning. First off, we know that losing an hour of sleep when we spring ahead can have some health effects. So what are the biggest risks in the days right after this kind of time change?
Yes, thank you for having me. Yes, we've all lost an hour's sleep last night, right? But more importantly, I know we don't feel well, but there's been associated health risks in the few days and weeks after daylight savings time change. From a public health perspective, there seems to be more motor vehicle accidents during this period. In the medical world, there seems to be more medical errors. And interestingly enough, the Monday after daylight savings time, stock markets also seem to be most volatile. From an individual standpoint, though, our health risks in the few days and weeks after daylight savings time change include increased risk of cardiovascular disease, such as heart attacks and arrhythmias like atrial fibrillation.
And as a sleep specialist and physician, how do you explain the time change actually impacting these risks? It's tough to understand, to be honest.
That's a great question, and the answer is probably twofold. One is sleep deprivation. We lose an hour of sleep, sure, but it's hard to actually make up that hour of sleep over the course of the weeks to months to come because of that prolonged sunlight exposure during the nighttime. And so we all get delayed a little bit, and we never really fully make up that hour of sleep. So we're chronically sleep deprived. Mm-hmm. The second reason is that there's a misalignment in our circadian biology or our circadian rhythm and the clock time. So we all perform optimally when our biology is correlated with solar time, but the clock time sort of works against that. Now you have more sunlight during the night, more dark time during the morning, and that's just not what our body wants to see.
So, Doctor, given all those facts you just laid out, the million-dollar question, how do people kind of catch up and get their lives back on track?
So for those of us who are suffering from what we call social jet lag, that's this circadian misalignment, and chronic sleep deprivation because we can't get enough sleep in there with the prolonged sunlight exposure, we have to be very rigid about our sleep schedule. So we have to, first of all, make sleep a priority, make sure that we have a regular sleep routine. We aim to get to bed on time. And for those of us who, are really affected by light, even manipulating the light exposure might be a way to handle this. So a light box, getting bright light in the early mornings and trying to minimize your light exposure at night.
All good things to know here. And we have to ask you a question just because we work a pretty crazy shift here. We're getting up at 1 a.m., 2 a.m., so we're not getting a significant amount of sleep at night. Obviously, our circadian rhythm is very off here on the morning shift. How do you feel about naps? Because Keith, Laura, myself, we agree that naps are healthy and important. Gil, not so much. So let's hear it from the expert.
Sure. Naps are actually a reasonable coping mechanism for chronic sleep deprivation. So a nap is healthy or can be healthy. I would minimize those naps to 20 to 40 minutes, not very long naps. These power naps are invigorating. They'll sustain you for a few more hours, but you don't want to make the naps too long because then you'll bleed into your nighttime and you might have trouble sleeping at night. You might experience some sleep inertia if your nap time is too long.
All right, Doctor, we appreciate it. I got to cut down on my naps.
Thank you so much for your time. We appreciate the conversation.
Doctor, thank you.